What to do when bitten by a dog? Depending on the size and strength of the bite, you may face risks such as skin abrasions, infections, blood loss, or even rabies. Rabies is the most dangerous and can be fatal if not treated properly. Rabies is caused by the Lyssa virus and is transmitted from animals to humans through saliva or blood. Once the virus reaches the brain, symptoms like seizures and muscle dysfunction may occur. The risk of death is 100% once the virus reaches the brain. Currently, there's no cure for rabies, so the most effective prevention is the rabies vaccine and immune serum if administered before the virus spreads to the nervous system within 7 days of being bitten. So, what to do when bitten by a dog? Step 1. Treat the wound. The first thing to do is clean the wound immediately after being bitten or exposed to the animal's saliva through an open wound. Cleaning the wound helps prevent infection and can wash away any potential rabies virus. Rinse the wound with water for 10 to 15 minutes. Soap can be used for better cleaning. Disinfect with 70% alcohol or similar antiseptic solutions if available. For deep, bleeding wounds, the priority is to stop the bleeding to reduce the risk of excessive blood loss. Go to the nearest medical facility for proper wound care. Step 2. Monitor the dog that bit you. For minor scratches, no bleeding, and wounds far from the central nervous system, patients can monitor the dog at home if the dog is vaccinated. If within 10 days, the dog shows no rabies symptoms and remains alive, the patient can feel safe. However, if the dog hasn't been vaccinated or shows symptoms like excessive drooling, aggression, or excessive barking, the patient should visit a medical facility as soon as possible to avoid the risk of rabies transmission. Step 3. Get vaccinated. Rabies vaccination should be administered as soon as possible to slow down the spread of the virus to the central nervous system. According to doctors, rabies vaccination should be administered within 7 days if bitten or exposed to saliva from a potentially rabid animal. In Vietnam, there are 5 types of rabies vaccines available. Vaorub from Sanofi Pasteur, Abharib from India, safe and without side effects. Rabies, PCEC, commonly used. Speeder from China, effective in preventing rabies. HDCV for pre-exposure protection. Step 4. Get rabies immune serum. Rabies immune serum. SAR is made from horse blood and contains antibodies against rabies virus. It's an effective preventive treatment, creating passive immunity that slows the spread of the virus until the rabies vaccine takes effect. Immune serum should be administered on the first day after being bitten and is most effective within 24 hours after injection. If not used within the first day, it can still be injected up to 7 days after the first rabies vaccine dose. Note: rabies immune serum is typically administered along with the rabies vaccine but in different locations, only subcutaneously or intramuscularly, never intravenously